breastfeeding in Ghana has declined by 20% points in the last 10 years. That's according to the Ghana Health Service in its latest report as it joins the world to observe Breastfeeding Week. The service also indicated that the situation has been compounded by the raging COVID-19 pandemic, which has disrupted breastfeeding support services. Theophilus Saki has more in the following report.
Data from the Statistical Service shows that exclusive breastfeeding for newborns has declined from 63% in 2008 to 43% in 2017. Deputy Director for Nutrition at the Ghana Health Service, S.C. Oforiwa Amuafol, explained what may be accounting for this phenomenon.
The fact that a lot of women today, more than ever before, are working away from home, either in the formal sector or informal sector, selling as employers on their own, but also others are moving away to sit in corporate organizations to work. And if one considers that the paid maternity leave period is for 12 weeks, but the global public health community, including WHO and UNICEF, recommends that a child is put to the breast within the first 30 minutes of delivery, and he or she is fed with only breast milk for the first 6 months. And you position this against the fact that one is those who are working are given 12 weeks maternity leave. That is one of the reasons why we believe they are not practicing breastfeeding. There are other factors, including the fact that there is a lot of advertising that promotes infant formula and position it as if it is better than breast milk. And when that continues for a long time, then women tend to lose confidence in their own ability to adequately breastfeed and nourish their infants.
According to the service, breastfeeding has been hit globally due to the COVID-19 pandemic. Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, noted the virus is not transmitted through breast milk.
Globally, the pandemic has caused significant disruptions in breastfeeding support services, while increasing the risk of food insecurity and malnutrition. There is growing concern that producers of baby food have compounded these risks by invoking unfounded fears that breastfeeding can transmit COVID-19 from the mother to the child and marketing their product as a safer alternative to breastfeeding. The World Health Organization continues to recommend that standard infant feeding guidelines be adhered to during the COVID-19 pandemic.
Speaking to Joy News, he highlighted some of the interventions introduced by the Ghana Health Service to address the phenomenon.
One of the key areas we are looking at is workplace support for breastfeeding, where companies, workplaces, whether it's a market, whether in the malls, we create special places where mothers who are breastfeeding are able to breastfeed safely and in dignity, so that we can promote that. We're also looking at how they are able to teach them on how to be able to even store breast milk and be able to sell breast milk, even in the extent that they are not there.
Theophilus Saki's report for Joy News.
Now, let's go on to Zoom now and speak to A.C. Oforiwa Amuafo, who is the Deputy Director for Nutrition. Thank you very much, Madam, for your time here on Joy News Prime. Now, let me start with the very last point that the Director General of the Ghana Health Service made, which is supporting women in workplaces, especially to be able to breastfeed. Is this something that has started already, or you're yet to roll that out? Madam, I think you have to unmute your device so we can hear you.
Thank you very much. Good evening to you and your viewers.
Good evening.
The program has started. We have already engaged a number of corporate organizations.
Okay.
And the aim is to build their capacity and support them, create spaces in their various organizations where their employees, females, but also their spouses, if they can bring their children to the workplace, can comfortably bring their infants so they can feed them and continue to work adequately so that the baby doesn't suffer, the mother doesn't suffer, and the employer does not also suffer in terms of absenteeism and poor productivity.
And closely linked to that is a point you acknowledge in the interview with Joy News, which is the issue of many women, especially those in the corporate world, working long hours, having to work away from home. Is the Ghana Health Service in that regard considering making an input into the Affirmative Action Bill, for instance, that would deal with issues of maternity leave? Is this something you are interested in?
Absolutely. Indeed, we have initiated discussions with a number of organizations, employers, and other groups that can facilitate the process. And ultimately, the intention is to request for an extension of the current 12-week paid maternity leave to the new provisions that the ILO Convention 183 indicates that countries should take steps to extend the maternity leave to at least 18 weeks or beyond. And that is the current engagement. And at the end of that process, it will be sent to Parliament for it to be ratified.
One other thing that caught my eye in your press release is the fact that you say breast milk is the first vaccine that a child receives from the mother. Very interesting in the face of the pandemic we are currently facing. Tell us about how COVID-19 has affected breastfeeding and whether or not COVID-19 can be transmitted through breast milk or breastfeeding. Educate us on that.
Thank you. As we indicated in the press release, all over the world, including Ghana, the health systems, one way or the other, have been affected by the pandemic in terms of access to antenatal care, skilled delivery, and the immediate care when babies are born. Yeah. And the fact that these systems support new babies to be put to the breast immediately they are born, that is within 30 minutes. Yeah. And the same systems must support them to ensure that they are fed exclusively with breast milk for the first 6 months. So it is the overall effect on the health, access to the health systems that has ultimately affected breastfeeding. And as we've indicated, the World Health Organization, UNICEF, and other public health institutions like CDC have indicated that breast milk does not carry the virus or COVID. Today, the evidence points that COVID-19 virus is not transmitted through breast milk. And therefore, the existing recommendation for infant feeding still stand. However, one should take note that if the caregiver or the mother who is taking care of the baby is not masked or is not wearing the mask, then if she has the virus, she can pass it on to the child. So the transmission is not through breast milk, but it can be passed on, as we all know. And therefore, the recommendation is that even if a woman there's a probability that she could be positive, or she has been exposed to the virus, or she has tested positive, she should continue to breastfeed her baby as we recommend. However, she should wear her mask, wash her hands, and comply with all the recommended COVID-19 prevention protocols, including cleaning all surfaces that she might have touched in the process of handling the baby, and wash her hands before and after caring for the baby.
Madam, I'm grateful for your time. That's the Deputy Director in charge of Nutrition, Madam A.C. Amafo, that's speaking to us on breastfeeding in Ghana and how, of course, COVID-19 has affected the already declining rate.